Good afternoon, everybody. Looks like people are joining us right now, so I'm gonna wait a couple minutes before we start. All right, well, looks like we are set to go. Hey, everybody, my name's Alan Greenlee. Thank you guys so much for joining us today. Our workshop session is entitled Design Strategies for Affordable and Senior Housing in the Age of COVID-19. And so we're gonna have a conversation about building design in a period when folks are trying to adapt to these new realities. Our featured guests today are Katie Swenson, Senior Principal at Mass Design Group. She's a nationally recognized design leader, researcher, writer, as you can see from her background, educator, international nonprofit architecture firm whose mission is to research, build, and advocate for architecture that promotes justice and human dignity. Over the past decade, I'm getting inquiries. Bear with me a second. Over the past decade, they've partnered with organizations working on the front lines of the world's major health challenges. Also joining us are Emily Russ and Kiara Carvelli from Menorah Housing Foundation. They are a SCANPH developer member. Emily and Kiara are key staff engaged in resident services and human resources. Our agenda for today, I'll start off by sharing a few data points, and then Katie will discuss her firm's research. Our representatives from Menorah will share how they have had to modify their operations during COVID and what design features they're working on. Katie will offer some other commentary on housing as a public tool for health. And then finally, we'll have some times for questions at the end. So please type your questions into the chat box, into the question area, and then I'll facilitate that dialogue. First of all, let's talk about some of the data. The lowest income seniors continue to work later into life by necessity. 30% of 65 to 74-year-olds are projected to be in the workforce by 2026. I noticed today when I was reviewing this, and I'm actually in that demographic. The next slide, older households are already disproportionately likely to face housing cost burden. And on the next slide, lowest income seniors without affordable housing may increase by 2.4 million by 2038. And then finally, as the baby boom generation ages, elderly homelessness is projected to triple in the next 10 years. And with that, Katie, I'm going to give the floor to you.
Oh my goodness, you're going to tell us that elderly homelessness is going to triple in the next 10 years, and then you're going to ask
and then with
me
a smile,
do something? Yeah.
Yeah, that's a pretty grim picture, right? So let's have a chat about all that.
It is a grim picture. Okay, well, I'm so delighted to be here with you all and can't wait to hear from the Menorah team on how you guys are doing. I mean, honestly, you're the heroes right now at this moment. So really looking forward to that. I think our plan is to sort of jump in and get some presentation data out there, and then we'll have a conversation. So I'm going to share my screen, which maybe I'm doing already. Is that working? You guys see my screen? You can give me, yes. Okay, thumbs up. Good. So hi, everyone. I'm so pleased to be here. I'm dialing in from New York City, and been so delighted to be working with Mass Design Group. I've been with Mass for about 10 years in one way or another, but I joined the team full time as a senior principal just in February. So very interesting moment to join. I'd been a sort of cheerleader, connector. We shared office space, and then I had become a board member at Mass. So we'll put that a little bit in context. And I'll describe to you a little bit about how 2020 has gone for me. Mass Design Group is, actually we're up to now about 140 people around the globe. So we're not only architects, landscape architects, engineers, writers, filmmakers, researchers, we're actually also now doing a whole scope of work in, especially in Rwanda, where we have a new build company where that became necessary. We're an interesting firm. We are set up as a nonprofit by design. And that's, I would say, for a few reasons. One is it ensures that we have a mission and we have to stick to it. What's happening with my slides here? Did you all see that as well? Okay, we'll go back one. I guess what you see, I see, right? Which is a blank screen. Okay, we're just gonna roll with it. We are a nonprofit entity, which means that, of course, 100% of our work has to meet our mission to promote justice and human dignity. It also means that we are able to recruit some philanthropy to our work, which makes it a very positive model for us. I would say about 80% of our annual revenue is fee-for-service design work, like almost any firm. But the other 20% of philanthropy, I would argue, makes 100% of our work better. It allows us to do the kind of research that is necessary. It also means we can work with clients who might not normally be able to think that they can afford the services of a design team. It also comes in handy in a crisis. I put up here 3 books. This is sort of a absolute pitch. I've got them behind me. Justice is Beauty, Mass, released in just at the end of 2019. It's a fantastic book that traces the first 10 years of our work, both in Rwanda and in the United States. I've also put here my 2 new books, which have just come out in the last month. So I'm doing book talks and other things. Highly encouraged. Design with Love is stories from around the country, including a story from LA and a story from the border down in San Isidro, of community development and designers. So highly encourage that. And In Bohemia is a memoir that I put out this year. But today, of course, we're going to talk about designing senior housing for safe interaction. I think what you all are certainly experts in and know very well is that isolation and loneliness in seniors is a huge public health risk. And we know that, you know, from many of our partners like Menorah, I would say we work very closely. We're going to talk a little bit about 2 Life communities here in the Boston area, who's really taught us that that aging in community is really the goal. Amy Schechtman makes a distinction between what she calls aging in place, which often people think sounds pretty good and may mean that you stay in your home, versus aging in community, which may involve a move at a certain point, but into a kind of more supportive environment where ideally you'll be able to live independently until the end of your life. But what we know, of course, is that when COVID hit, all of a sudden our seniors were our most vulnerable, seniors and healthcare workers, helping them. So basically what happened for my sort of COVID story is I started at Mass on February 4th. I got a few weeks in the office, and all of a sudden we're starting to pack up and move home. We moved home on March 13th. On Monday morning, March 15th, the phone rang from Boston Healthcare for the Homeless, a longtime partner of ours. They were going to put up tent clinics the next day to test and treat their clients, and they asked if we would have a look at their plans. So essentially, we, of course, said yes and went about a process of trying to evaluate how they could create a tent clinic that would do its best to keep both clients and healthcare workers as safe as possible. And we started this series of work that we called Rules of Thumb. The first one was Rules of Thumb for limiting contagion in makeshift facilities. I think it's important to understand there were no COVID guidelines at the time. There were a lot of things we didn't know. But what we did know was that we'd had, about a dozen years of experience working in both medical and non-medical facilities to prevent the spread of, using design to prevent the spread of infection. So we've worked in Rwanda and other places where we had to be very careful about virulent strains of tuberculosis. We've also worked in Haiti on issues of cholera and in Liberia with Ebola. So we set to work trying to apply the best medical intel that we could into understanding what role could design play in this. Now, this work was fascinating and frankly ongoing, right? We continue it to this day. We haven't quite solved this issue yet. This particular crayon drawing is actually from Mount Sinai Hospital, who was looking at how to renovate or how to deal with the crisis in situ. What zones are sort of red, green, and yellow being sort of COVID hot, orange being transition zones, and green being clean. What we found through this kind of series of drawings was not only do you need to design a building in a certain way, but you also need a degree of spatial literacy by the people who are going to use it so that they can understand what's what. So we ended up doing this guide, designing senior housing for safe interaction along these premises that people 65 years or older represented at that point 80% of all deaths from COVID. That data actually would be probably from August. It has been updated since then. Older adults also need to balance another threat to their health, social isolation. So how do we design for safe interaction, not social isolation, was our charge. And so we added this guideline to our suite. All of these are available. They're free and available for download on our website. You go to Mass Design and there's a link on the first page. We've also been updating these as we need. So we set about a set of sort of general principles to understand how we pull the same principles from general design for infection control. And the first is make spaces breathe better. Emerging research is showing that COVID-19 is transmitted through airborne particles. So it's essential that proper quantities of fresh air be delivered to residents, evaluating and maintaining HVAC systems, but also supplementing air dilution with operable openings. Sequencing the flows through a space. We've all become quite cogent now in understanding how to do wayfinding, signage, what we've come to call spatial literacy, how to understand which spaces are clean, dirty, and also directing residents, service providers, visitors from sort of unnecessary mixing. Reduce pressure on high traffic places. Typical social distancing recommendations need to consider those with mobility issues as well, as we know. Elevators, hallways, and shared amenities and other high-touch, high-traffic areas pose a greater risk. Needs for additional seating in hallways to allow residents to safely pass each other, or designated spaces for queuing. I think this one, group residents into villages, is something that has been an important part of our sort of design strategy. And I'm going to show you an example of that later. The idea of creating small adjacent spaces or clusters that can offer interaction with a controlled set of other residents who may share some of the same amenities without having to rely on potentially higher risk areas such as large multi-purpose rooms or shared dining spaces. I think this intermediate zone is one of the kind of areas that we found that we've really been missing between the unit itself and the large group spaces. Expand the threshold of the unit. As more food and services are brought to the doorstep, the unit or house entry should adapt to spatial and behavioral needs. Signage clear to reduce delivery mistakes, designating space off the floor for packages and deliveries to keep circulation clear and reduce tripping and fall hazards. Of course, encourage people to get outdoors. We know that not only is risk of infection lower in open outdoors, of course, we all feel better, increasing both the quantity and accessibility of outdoor space. And I think importantly, creating a kind of diversity of space through scale and program. Of course, we also need to do some of these basics, increasing cleaning protocols for high touch surfaces, and embedding technology into all of our buildings as we kind of come to a moment where we know that we have to safely conduct wellness checks and communicate with residents. Standardized technology also creates sort of equitable access to communication, and I think reduces the burden on resident and service staff to have to work within multiple systems. One of the challenges in adapting these principles into a guideline for housing is that it's challenging to grasp all the different variations of housing and care types that exist for seniors. So these are meant to be sort of general goals. In our healthcare work, where we're able to code or color floor plans with clinicians to understand which rooms are dirty or had high risk, clean, low risk patient rooms, the distinction in housing, I would say, is more challenging. In housing, all homes encompass sort of a private and public realm. For those practicing social isolation and social distancing, it's been typically understood that when there are more people, public areas, there's a greater risk of contagion than when there are few people, or private, of course. So we try to understand this in a more nuanced way, not only seeing public and private spaces, but a kind of spectrum of experiencing between them, including semi-public and semi-private spaces that may change based on the resident's living and care situation. So we defined public, essentially the curb or entry, the public domain. Our assumption is that an individual has minimal control over infection measures and relies on others, government, policymakers, to sort of establish these norms. Then we get to the semi-public, where lobbies and shared amenities, shared circulation, resident social spaces, use of shared spaces are sort of known, giving individuals greater control and knowledge based on potential risks. Semi-private, where we can again have this idea of smaller potting. And then private, not obviously the unit interiors, where individuals have a lot of control over their amenities. So in the strategies for the public realm, the guide goes into a whole series of these kind of diagrammatic things. I'm just showing a few of them here. Establishing sort of rituals of washing hands in the building entry or placing hand sanitizers. All of these kinds of things that can sort of shape behavior in the public realm. And then in the semi-public realm, this kind of moment at the entrance to the building, how do we create sort of buffer zones at high traffic areas? And you'll see these kind of series of diagrams that, you know, may or may not apply to each of your building, but offer a chance for you to ask questions about what you're doing at each of these stages. I think this semi-public realm is going to be an area where we're really going to need to use design in new buildings and maybe retrofit old buildings to be able to kind of accommodate an idea of this semi-public space that would allow clusters of neighbors to see each other and gather, but do so safely. And then lastly, we go into the unit and make suggestions both at the threshold and of course within the unit itself to make sure that people are absolutely as safe as possible. We won't dwell too long, but I did want to briefly show this project that we're designing in Brighton, Massachusetts, a neighborhood of Boston called the project's called J.J. Carroll. It's a former site of a public housing site that was built in the 30s that's being torn down and redeveloped by Two Life Communities. We went through this larger process that we use at Mass, which is essentially called a purpose-built process. This guide is also available on our website. You have to log in, but it is free to download. And we've been working for quite a while with Two Life to sort of understand how the mission of their organization can then become a specific mission for a project, and that those two may or may not always be the same, that a mission for a project will be more specific. And we work with them then to look at the design issues that will allow them to quickly achieve their mission and measure those outcomes. So I just wanted to show a little bit the process that we went through. In this specific case in Brighton, the community, as it were, I don't have one of the before shots, but they were low-rise public housing type 30s units that had kind of fourplexes. You'd enter and you'd enter the same entry with 3 of your neighbors. And the community really valued these kind of pods between neighbors. So what we know, we look at the top diagram number 1, and in many ways we sometimes do this kind of double loaded corridor as a quick and easy way to sort of design a senior housing building. So we looked at what it would mean to break that mold into smaller clusters with 4 to 8 units per neighborhood. And you can see as we kind of walk through this diagrammatic process, we're trying to kind of cluster groups into smaller neighborhoods that then have this, what we're calling semi-private realm where residents can gather. You can also see that the massing of the building is going to allow for greater airflow and some of the other benefits. So this became sort of our one of our sort of plans that's activated here. You can start to imagine how, rather than the sort of double loaded corridor, we're able to design this building in a way that we're able to kind of pod and make sure that over the long run, no matter how long this epidemic lasts, that we're building in these smaller, safer places for residents. So I think I'm going to end there and turn it over to Menorah, and then we'll proceed in the conversation. But the last thing I'll just say is that, I think that while we did our housing guide focused on seniors, because in many ways their needs they have the kind of most vulnerable combination of being vulnerable to infection and illness, but also being vulnerable to social isolation, but that all these principles can generally apply to really housing of all types. Okay, I'm going to turn it over to you all.
Great, thank you, Katie. I'm just going to share my screen here.
Yes, thank you, Katie. That was really interesting. Thank you. And yeah, it leads really nicely into us. So Menorah Housing Foundation, like Alan said, we are one of the member organizations, and we provide affordable housing for low-income older adults strictly. That's the only thing that we do. We have 18 buildings all across Los Angeles in varying sizes. And to just kind of give you like an idea of what the buildings are like. So they're different sizes, they're in different places across Los Angeles, and they're populated by the residents, of course. And then there's a manager, a service coordinator, a maintenance tech, and the staff move around from building to building since we're all, covering all of these different buildings. And in March, it's just funny that you knew it was March 13th. We all know it was that Friday, March 13th, right? That was that week. We're all watching the news. Everything's changing. And here we are as an organization with a huge population of people who are now known to be in this very high risk category, with possible multiple chronic health conditions. We have staff to concern ourselves about. We had a lot of questions that we had to sort of figure out how we were going to respond to in a very short amount of time. And these ranged from paperwork to resident services to maintenance to just all manner of things that we're gonna have to shift now that this pandemic has happened. And before I pass it off to Emily for the next slide, one thing to note is that all of our buildings were in place. So we had no major design opportunities prior to the pandemic. These are existing structures and we needed to work within them.
Great, thanks, Kiara. So on an operational and administrative level, our first thought was, of course, employee safety. How are we going to keep our staff of 55 people safe from this pandemic while we respond to these anticipated crises that come up on a weekly basis for us? We already know they're going to happen, but what is that going to look like for us in a pandemic when we don't have the freedoms we're used to? So we started by educating ourselves as much as possible, and then the tenants and the staff as quickly and accurately as possible with notices and phone calls and emails. That Friday the 13th, you know, everybody's in the office, everyone's at their buildings, and then by Monday and Tuesday, everything was different. So we changed a lot of work schedules and locations. We have 19 of our staff already living on site. So we tried to keep the people that were on site just working at their buildings, which was actually a big change for a lot of people. But we wanted to reduce this cross-contamination between buildings. So we didn't have employees hopping from building to building anymore. And a lot of us went remote. Of course, we are essential workers, so we did need that core staff able to be on site, but so many of us went remote. Our IT setup was so critical during this time. Luckily, we have a great IT specialist, and he kind of had set us up with infrastructure that was easily adaptable to remote. And another thing that's interesting is we were already kind of used to being remote because we're at these different locations, but it was still really challenging for us, even though we were able to do it. And then another challenge we came across is that HUD and the city and the county still required all of this reporting from us, some of which, like recertification, is a very lengthy in-person process with the residents, and we had to figure out how we were going to do this. Our maintenance team has really held it down these past few months, but we wanted to make it as safe as possible for them. So we created a work order triage process where we prioritized any emergencies, and then anything like, you know, a blind fell down or something, we would say you're going to have to wait a little bit for something like that. We outsourced to a lot of vendors, especially in the first few months when we were really concerned about our maintenance guys going from unit to unit and being exposed. But when we did have to send a maintenance person in, we would call residents ahead of time, tell them to open their windows, remind them to social distance, put their mask on, and pre-screen them, and just try and limit our time. And of course, getting full PPE for everyone was important, but actually a huge challenge. As you guys know, the suppliers were just out for weeks on end. So we had to pull a lot of strings to get proper PPE for everybody. Then, as Kiara said, all of our buildings were already in place. So we kind of had to work with what we had. So these are our design changes. We removed common area furniture. At my Long Beach building, they were a bit resistant to this. They just kept wanting to gather in the main lobby like they always did. And they were like, we're going to die anyway, Emily, like we can be here. And we're like, we're going to take away this furniture. And then we put that to a stop. So we did other things, unfortunately, like closing community rooms where they used to like to gather. But we just had to do what we had to do. And we installed additional drop boxes in some of the service coordinator offices and managers' offices so they could give us paperwork. We could do whatever we needed to do with it and then get it back to the residents without any in-person communication. In this picture here, you see an example of a plastic shield. This is a portable one. We got those for every building to use when we did have to do like an interview process. because of course, during this time, we still have vacancies. We still have to interview people and get all their paperwork for a new move-in. So we had to do some things in person. So we would set this up, be very distant in our full PPE with as much airflow as possible, and then get those things done. For our buildings that did have sliding windows in the offices, we saw a huge increased use of them. All of our buildings are a little bit different, so not all offices have this, but residents are able to slip rent in there or just kind of talk through the glass and you can still hear. So it felt a lot safer to us. Our safety notices are on all our entrances to wear masks and limit guests. And then we increased our cleaning, of course, and then just opened a lot more doors and windows than we had before to just increase that air circulation.
So that also leads us to the service coordinator program. So we are a group of 10 people who used to, who serve all 18 of our buildings. So most of us had a couple buildings that we were going to on a regular schedule. Again, from Friday to a Monday, 9 out of 10 of us went home. We did have one service coordinator stay on site to cover a different colleague who was out. So she did actually stay at the building, but the rest of us went home and really just launched ourselves into a very extensive telephone outreach program where the point was to let people know of the changes, offer all the new services that were available now because of the pandemic. I mean, we really hit it hard with the delivery services. There's meal programs, there's prescription delivery programs, volunteer matching, friendly callers. There's all kinds of new things that came out of the pandemic. So we spent a lot of time talking to people, letting them know it was available, signing them up for things. We also tried really hard to increase our participation in the online rent program for obvious reasons, not having to write the checks. It's easier for everyone, less in-person interactions. And during all this time, we did what we always do, but even to a more mindful degree to really understand who's home, who's at the hospital, what caregivers and family members are in play. So really understanding the dynamics of all of our tenants so we can really help manage all these things, not knowing what was going to happen in the future. And one of our biggest challenges that we've noticed during this time is that the tenants who have physical disabilities or people who don't speak the same language as us, losing some of that in-person ability to use our body language, read lips, write things down and show them and do those kinds of things. That's been a real challenge for us to do over the phone. It's a lot of talking and not a lot of all the other things that we were able to use to communicate. On the next slide, it shows that we also changed some of the programming that the service coordinator team is responsible for. So pre-pandemic, we're having monthly educational workshops. We have ongoing classes, classes that include fitness, exercise, art, meditation, you name it, we're doing it. When the pandemic hit, we really just decided to do a full stop cancel. We were all acquainting ourselves with what was happening. We didn't really know. We obviously had major safety concerns. As I said, our residents are like the most high-risk category. We were very worried. We put a full stop to everything. As time went on, we were like, residents are getting a little isolated and strange. Let's try to bring back some of this programming, get people engaged. So we were able to shift a lot of our classes to sort of different formats. So some of our teachers did things that were pre-recorded. We passed out DVDs. Our wonderful art teacher made pre-packaged art supplies for the participants and would drop them off, and then they could work on those projects all month till he replenished them. So we did as much as we can to just try to stay engaged, involved. And recently we did bring back some, as you can see in the picture, some outdoor fitness classes. That's our wonderful Tai Chi teacher. So where it was safe and we were able to social distance and do all that, we brought them back. I would love to keep it going. The landscape in Los Angeles is changing very quickly. So we just don't know what the future is going to hold for us.
Okay, great. Yeah, so just to kind of wrap up, we wanted to talk about what we discovered since March. And managing residents' expectations kind of came in first and foremost. Letting everybody know as soon as possible what they can expect to happen from us and what we expect from them. Telling them about these, preparing them for how maintenance is going to come into their unit now, that the service coordinators aren't going to be on site anymore, that they can't just come up into our office anymore like normal. It took away a lot of the casualness of it. So we had to just express those expectations to them.
Oh, it looks like Emily froze. Did she freeze for you guys too? Is that a thumbs up? Okay, I'm gonna jump in for her. Oh, Emily, you froze. Are you back?
Am I back?
You're back.
Sorry, guys.
Oh,
Okay.
that's okay. You're back. Okay.
Way to jump in. Okay, if I'm still good, I'll keep going, but let me know.
You're
Okay.
good.
We really appreciated our outdoor spaces, and most of our buildings do have ample outdoor space. So we could use, as you see in this picture, for outdoor gatherings, but we came across things we never anticipated, like having the sun at different parts in the building. Like I was going to hold an outdoor bingo class and I had it all set up in the front, and at 2 p.m. everyone was like, it's so hot. And so we moved everything to the back patio, a back patio I'd never even really set foot on. I never used it, but it was great and we made it work. So just being aware of that and what chairs you have and tables are just things we didn't think about before that now we rely heavily on. And then airflow design features. We talked about this a lot, but just having windows that open, and 2 of our buildings, Long Beach and Menorah House, have these big open corridors that allow all this airflow from the top to come in, which has been great. And then having sliding glass windows in offices, and then balconies are just an absolute lifesaver because residents can go get some sun or yell over to a neighbor with pretty much zero risk. And then, as Kiara said, we've just been seeing the social isolation really get some of our residents down, especially those who were already having some cognitive decline or running anxious or depressed. It just has exacerbated those issues. And like Katie talked about, you need this balance between the safety and the mental wellness. So in the beginning, we were kind of more in the vein of stay home no matter what. And now we're more, the message is, put on your mask, go on a walk with your neighbors, stay distance, but get that in to feed yourself. So you're gonna, last through this whole thing because it's gonna be a long time. And then just internal communication has been absolutely imperative. Even for us, we were used to being remote, as I said, but not seeing Anna in the office anymore to tell her that 215 called and this is happening at the building. It's just easier to forget those little things. So to put them in an email or pick up the phone has really helped. And then finally, just to recap the future considerations, expecting confusion is a good thing to be aware of, and being patient as you guys undergo these processes that are always going to be changing. It's okay to over communicate. You're not going to put any strain on anyone right now because it's better to tell somebody something twice than not at all. And designing buildings with just a lot of open air space, balconies, glass windows, and drop boxes has been great for us. Making sure your outdoor spaces you can use all year round. That's only something I could say in Southern California. And then that no activity is zero risk, but finding ways to engage residents that is just as low as possible using those outdoor spaces or phone activities. And I'll just send it back to Kiara if she has anything else to wrap us up.
I think, no, that was great. I think we covered everything that we wanted to say, and of course we'll be open to questions later, but just as a quick note, because Katie was talking about sort of like wayfinding and like people congregating, other than our community rooms and like deliberate activities that we would have, it doesn't seem like there has been a huge need to mitigate that in our buildings. People sort of flow into their mail room just as they come. Taking away the furniture has really helped us with that. And that might be different than other places that are maybe a little bit more institutional, at just an apartment building, even like at my apartment building, maybe I see a neighbor at the mailbox, maybe I don't, So, but it is something interesting. And I really liked what you said, Katie, also about finding places to put things that are off of the ground for mail. I had never thought about that before. And I think that's something really interesting that we could consider. So thanks for that. I see a question. Are we supposed to answer those, Alan? Are you gonna, or do you?
Yeah, well, sure.
I
Is
see
this the one
something.
from Sally? The one that
Yeah,
asked
that
about the
says-
people with disabilities? Yeah.
Yeah, so you know what? We are just a regular apartment building and we don't have any control really about who comes in our door. It's up to the tenants to who they answer and who they let in. What we do have is locked entries. People do have to, you know, call the resident and be buzzed in. You cannot just walk into the building, you know. And so we're not, you know, we can't stop caregivers. We can't stop anyone from visiting. We have signs up all over the entrance about the COVID protocols and what we're expecting. If we see people without masks, visitors without masks, of course we say something. We expect people to adhere to those. But yeah, ultimately, just as we're all seeing nationally, there's a lot that rests on the individual to do the right thing.
Thanks, Kiara. Here's a new one. Can you explain what you meant by reducing pressure on high traffic places? It was one of the on one of the earlier slides.
Yeah, I guess, you know, I mean, I think this is true of, and, you know, when it gets to your building, right, you have to figure out in your building what that means. It's interesting to me. I wonder, are we going to put back a sofa or a chair into the lobby? You know, will we do that? What are the high traffic areas? And, you know, at one point we were looking at a project that a colleague of ours was designing. They were designing kind of one-way hallways. So there was sort of a loop, and they had the ability in their design to be able to do a one-way hallway. So, you know, obviously that's not going to be true everywhere. But are there, you know, sometimes that mailroom does become kind of a cluster. So I think it's about the individual buildings, but I guess for my money, I'd like to think that we're going to put furniture back again at some point. You know, that we are, I think that's part of this idea about can we pod in a way? And I wonder if you guys have any experience with this idea of smaller clusters of residents who kind of agree to protect themselves and each other, for example. And if that's something that you've found in your work, if that's been effective.
Are you talking to us?
Yes. Yeah.
Yeah, you know, and Emily, sorry, I'm not trying to dominate, so you jump in whenever, but you know, I just feel like our tenants are in some ways quite antisocial generally. You know, when we, I mean, not in really even in a negative way. It's just, you know, like we want to host something, we think it's going to be great. You know, 5 people come. You know, a lot of times people, and so then there's sort of like a self-selection to little groups of people in the buildings. We don't generally have large groups of people like a junior high where everyone wants to hang out together. It's like not happening at the buildings, like little bits sort of self-select and like hang out in general. And we did, though, just to sort of speak to like the deliberateness of a pod, we did at some buildings, and Emily, maybe you can say, have a couple service coordinators be like, hey, if you don't have a family member, you don't have a caregiver, what about teaming up and getting a buddy? You guys talk to each other every day. You can look out for each other and sort of be that person for each other. So we did do a little of that.
Yeah. Wow, I forgot all about that. That whole March is like a blur, but we made spreadsheets and like called every resident, asked them, do you want a buddy? And if we did, we kind of paired them with someone who they could look after. And then if I like highlighted my people in red who were like high risk people, they don't want a buddy, they don't have a lot of family coming. That means I'm going to call them more, basically.
And I'm with you, Katie. I want to put our furniture back one day. Like, you know, I think it really became apparent, like we'd all just been saying, you know, we were very stringent at first and we're like, nobody talk to anybody and don't go anywhere. And then tenants who were relatively like normal, not impaired, we've even seen them just slowly decline, and it's alarming. And I'm like, wow. Even, you know, it's funny when the research just comes right to your face. You're like, it is so obvious that social isolation really can affect your brain. It is really happening right in front of us because we're talking to the residents and we can just see it happening.
Yeah.
Yeah, well, speaking to that isolation question, as a follow-up to the access to the building, there was a question here about what did you guys do to control for visiting caregivers, friends, and family? How did you handle that? And did the buildings incorporate universal design?
Oh, yeah. That's sort of what I was mentioning before. There's not a whole lot that we could do to be, like we can't really police that so much. We put up all of our notices, of course, controlling for the COVID protocols as much as we can, but ultimately, it's up to the individual residents of what they're going to do about that. There's really not a whole lot of control that we can have because we're not an institution. We're really just a regular apartment building. I mean, service coordinator program is voluntary. They don't have to talk to me or Emily ever if they don't want to. It's just a regular apartment building, really, and the amenities are there if people use them. Does that answer that?
I think so. I think between that and the response before, do you have any?
Group of questions around universal design, and I saw, in addition to elderly, also interested in design related to persons living with disabilities. I think that it feels like that persons living with disabilities who aren't elderly is kind of an underserved group of people from a design standpoint, I would say. I'm not sure that that's true, but of course you guys, I'm sure, know the numbers way better than I do, but there's so many people who are living their entire lives, having to use alternate modes of transportation or other things. And I think that's, I think in the larger sort of affordable housing world, it's a population that's a little bit underserved. And I would worry, I don't know if during COVID that becomes particularly problematic, more so than for other populations or other peoples. But I do think generally, most people are pretty good about meeting kind of the basic requirements of universal access, but how do we go further to make sure that our buildings are really being welcoming and really serving a whole gamut of people?
Yeah, I can speak on that a little bit. I know Anne's the president of Menorah Housing, and she always has universal design kind of at the forefront of her mind. And we have a whole presentation on this, but our buildings, especially as time passed and we learned from past buildings, like having like low grade slopes coming up and grab bars and roll-in showers in all of the units, and just not a lot of thresholds. So if you're wheeling a walker, you can go from room to room without having to go over like a little bump, and having all of our countertops at the right height so anyone can access it. And so when we were designing our buildings, we kept it in mind just for people to be able to stay there in any condition they were in as long as possible.
Absolutely. Using colors, wayfinding,
Yes.
any number of things. Yes. Because people come to Menorah and they don't leave. They don't want to.
No.
There's only one way they want to leave, which is fine. That's what we want too.
Yeah, we have big numbers on each of the floors to help prevent them from getting lost and confused going from floor to floor, and just a lot of lighting up the unit numbers and the walkways and all of that. And a lot of our buildings have doors you can push to swing that they open automatically, and just all of that really, really helps.
2 elevators.
That's those design questions are to be addressed are interesting to me. I wonder, Katie, I wanted to come back to your remarks about the purpose-built process. And that alignment between organizational mission and then building mission. My question generally is, to what extent has the pandemic sort of impacted that work? And then if you had anything else to say on that.
We actually, yesterday we went through what we have a process that we call an IDM. Impact-based design methodology. And we're working with a nonprofit developer in Brooklyn on an RFP for a senior housing project that will be in Brooklyn. It would be on a NYCHA campus, or it will be. What we've found a few things as we work with developers. I worked with enterprise community partners for 13 years. And one of the projects that I started there was something called the Affordable Housing Design Leadership Institute. We came to understand that, of course, the developers of projects are the ones who are really the lead designer, right? They need to be the design champion of a building. If they're not going to bat for the design of the building, they're the ones who have to navigate all the financing and policy and neighbors and everything else. So one of the things we realized at Enterprise is that if we wanted to see better design outcomes, we needed to help developers become sort of better design champions, to know how to work with their architects better. And part of that involves really arming the development team with a very strong mission to their project. Again, all nonprofits seem to have a mission, but how do you articulate the specific mission of a specific project? And I think in some ways it helps you get out of ideas of like style, like, oh, I like it or I don't like it. Because when you focus on a mission, you can gather your team, whether that's your funders or the neighbors or the assemblywoman in the neighborhood, and kind of engage them in a shared project. So anyway, we went through this IDM process. We used a technology called Miro, M-I-R-O. Sometimes we also use one called Mural, M-U-R-A-L, which is kind of an online engagement technique. And we go through a process of establishing the mission, the method, the outcomes we seek, and then the larger systemic change that we hope that the project will accomplish. And as we work through the design decisions, we try to keep this narrative really at the forefront so that the developer is always able to be very clear and transparent about their top line mission, how the individual design moves are able to be the method to get to that mission. And it's not only design, of course, it's also programming, how you run your building, all of the other elements. And then also bake into the design process an outcome-based approach where you're able to start to measure how well the building is performing. And then, the idea of systemic change is that, we don't want to fight the same battles the next time, right? We want each project to be able to advance us so that we're kind of bringing up the whole as we move forward. But yeah, it's a very powerful process. We've got it pretty well worked out. I'll say most people don't use it. I mean, most people, most architects you're going to work with they're not necessarily going to use that process, but as the developer lead, you can insist upon it, and we have some tools to assist you. You don't have to work with us. We're pretty open source about these things. So, it's up to the developer, I think, ultimately to really be the design champion. And so I think that business about developers being real clear on how to articulate their mission, what works, why they're making the decisions that they make, and then use your architect to get to those big questions, I think is ultimately the best way to go.
Yeah, just adding on to what Katie said, something that has worked for Menorah is getting our maintenance supervisors involved very early on in the design process, because the maintenance team is in the units and they know what's working and what's not working. So kind of incorporating their feedback along with what the residents are saying has really helped us and the design team continue to make better and better buildings.
I just think it speaks to what you're saying, just aligning the mission and the purpose, form and function, you know what I mean? The mission and the purpose of what we're doing with who's going to actually inhabit it, Again, Emily, we have a whole other presentation on this, so knowing that people live so long in the buildings, some of those design features that Emily articulated, and just getting the practical people in on the process early, learning to, we learned early on that we need to be very wise about that kind of stuff. So we don't have buildings that are useless for us once they're built, So I think that's something that we're really, really trying to be attuned to all the time, because it just is so important.
I could,
That's great.
yeah, go ahead, sorry.
Well, if you have something to expound on that, because I do have another thought, but it's slightly different.
I was just going to share, you're going to see my messy desktop, but I'll just share briefly. I think, first of all, this is kind of, this is a little bit the slide that I think will kind of shows, this is from Enterprise. This idea that, of course, as architects, we think that it's a developer design team relationship. But we know that's not true, that really here's the developer at the center having to navigate all of these. You guys can tell me if this looks like your world.
Well, Katie, we're not seeing your desktop.
Oh, you're not?
I can't see the image, yeah.
Oh, I'm sorry. Sorry about that. I'm talking into the void. Can you see me now? Okay, there we go. Okay. So yeah, I was saying that, in some ways this is the point of view of a designer. It's all about us. You hire a really good architect. We always recommend that, of course, and hire a landscape architect with your architect. Don't use a sub, but that what we know is that this is really the world of the developer. You guys can correct me if I'm wrong, but that in essence, if the developer is not being the kind of design champion, that project's not going to happen. I also thought I'd show this diagram, which is from one of our Rose Fellows, one of the Enterprise Rose Fellows that we describe in the book Design with Love. This was how he diagrammed his organization. These sort of two chains that, you have your architects, project managers, real estate developer, and then on the other side, the property management and maintenance vendors and subcontractors. So he saw his role as an in-house designer as being the kind of person who was able to learn from the maintenance vendors and contractors to be able to bring that information back into. So sorry for the technical difficulties, but thought that would be a good thing to show.
That's okay. Those images, picture is definitely worth 1,000 words in those cases. Yeah. Well, I feel like we could kick this along for a little bit longer, but I'm realizing that we're sort of at time. So I'm going to take this opportunity to thank you, Katie, Kiara, and Emily for your really terrific presentation today and for sharing this time. And then I think we had, I don't know, about 70 or so participants. So hopefully all the folks got a chance to learn something there. And it sounds like they did. So again, thank you very much. I hope everybody enjoys a safe holiday, and we'll see you soon.
Thank you so much
Ellen,
for having us.
Yes, thank you.
And nice to see you, Katie.
Yes, you too. Beautiful work. Thank you.